and I'm the program manager at the Center for Work and Family Life at the Health Science Campus. And we're all going through so much right now. This is unprecedented what we're dealing with. We're dealing with the pandemic and the uncertainty of that. We're dealing with racial and social injustice, civil unrest, and now the economy fallout. There's so much stress, and at the same time, we all need to continue to work, meet deadlines, achieve, but it's hard because we don't always have the motivation or the focus, and sometimes we're just drained from everything that's going on. So what I hope you get in the next 15 minutes is some tools and tips to be able to enjoy your personal achievements and your work achievements, and to meet deadlines and to be motivated during this period and to learn some techniques. So right now, as employees, we're going through change and transition. There's different groups going through this. There's the frontline workers at Keck Hospital and the other hospitals that have been working all along. There's a lot of healthcare workers who are returning to the clinics, and they all have concerns about their safety and working with patients, and if they'll get infected and bring it home to their loved ones, their spouse, their partner, their elderly parents, their children. So it's a lot of stress for them to worry about that. At the same time, doing what they love and what brings them joy, taking care of the patients. There's people who found out that they'll be returning to work shortly, either in the next couple weeks or months. They had a hard time adjusting when they first were told to work from home, and it took a few months to adjust, and now they got to get back and going to work. And they have concerns about returning to work under the new norm with social distancing, wearing a mask, learning a new routine. There's another group of people who are working remotely that will continue working remotely, either full-time or more on a hybrid model where they come in a few days a week and they work at home a few days a week. And there's pros and cons to every group. And the pros and cons to working from home is, you don't have the traffic, less commute time, more time to have deeper connections with loved ones and family, more time to cook healthy meals and exercise. But there's also the stressors of balancing your kids' Zoom classes with your Zoom meetings, finding a quiet place in your home for an internet connection, and then sometimes being with family and loved ones too much when you're not used to it can create a lot of family tension, and you can sometimes feel claustrophobic. So this creates more family tension. Sometimes people when they're home, they don't always cope as well. They may use more drugs and alcohol. So for all these groups, you're going through a transition, and we will talk about coping mechanisms to help you through this transition so you don't feel so alone. The main thing is to be aware of your emotions, because when we're going through so much, our emotions can catch up to us. And Daniel Goleman wrote a book, Working with Emotional Intelligence. And he talked about 3 key areas: self-awareness, self-regulation, and social skills. Self-awareness is to be aware of what your triggers are, and your triggers may be different now than they were before COVID and this whole shutdown. And you need to be aware of what triggers you, and know your strengths, know when you need to reach out for help, set limits, ask for help, even reach out to counseling services like ours just to get that extra support. Also, during times like this, it can affect our confidence. We may second guess ourselves, which is very normal during these times. So be aware and feel good about what you have done. Tell yourself that you've adjusted the best you can and what you have done as far as all these changes. The reason it's important to self-regulate to be aware of your feelings is so you can self-regulate. You want to be able to keep your emotions in check. What happens is when we're not aware of our emotions, we don't self-regulate, and it can come out where we get angry, we get upset, we say things that may hurt other people, and that really isn't our intent. So it's important to self-regulate so we can continue to build trustworthiness And if we don't self-regulate, that's okay. We can go to the person and say, hey, I made a mistake. I lost my cool. It wasn't my intent to hurt you. So we can all think of a time in our lives where someone didn't self-regulate, and maybe we lost a little credibility for them or a little respect for them. Under self-regulation, it's also important to be aware of it's a time of change and transition, and you need to be more flexible and think outside the box and be more innovative. During these times, it's important to communicate more, communicate, listen more, and give feedback. Try to negotiate if you're dealing with stressors at home and who's going to do the chores and the household chores. Negotiate what works. Try to compromise. And if you need more space, ask for it. Collaboration during this time and team building, especially as we're all transitioning during this period, is really important. What brings you joy? So the key is we want to achieve certain things while we're in work. And to do that, we need to be in check with our emotions, and then we have to focus on what brings us joy so we can do those things every single day. So what activities do you do that bring you joy? How often do you do them? And when's the last time you did them? For many of us, the things that bring us joy, we haven't done as much because of the shutdown, and we haven't been able to go to the gym if we're used to going to the gym, or going out with friends for dinner or coffee. Some of us have learned new coping, healthier coping, like walking or hiking, which is great. So think of what brings you true joy, and maybe when's the next time you can do them. For some people, getting away and planning time away. Not everybody's flying right now. That's okay. Maybe you can drive somewhere. But when you plan something, you're on vacation, and just the planning process is really good for you. Achievement and enjoyment. Many of us get caught in the as soon as trap. So, I'll be happy when I finish that big project. I'll be happy when we get back to work. Be happy when my kids go back to school. Well, it's a trap because we're not enjoying the moment. And when we don't enjoy the moment, we get overly stressed, causing us a lot of anxiety and a lot of depression. And we use unhealthy coping because we're not enjoying life anymore. It's a big drain. So I want each of you to think in every area of your life, whether it's work, family, friends, or self, what you want to work on as far as goals and what you want to achieve, and then what you can do to bring you joy through the period. So let's say you have a big project at work that you're working on and you have a deadline. What will help you get through it? Do you like to collaborate with your colleagues? Will that help you? Do you want to learn new systems or new ways of doing things? Is that exciting for you? Will that bring you joy? What about with family and friends? Some of us haven't been around our family and friends as much, and we miss them. And many want to reconnect. And some have been doing that through Zoom happy hour, which is great. But now that some of the restrictions are more relaxed, maybe we can meet with small groups of family and friends and social distance and wear a mask, but do things that bring us joy. And then what about for yourself? Think about what your goal is, what you want to achieve, whether it's exercise or reading more. What is it that will make you happy and feel productive in your personal life? And what can you do that's joyful during this, like a certain exercise that you enjoy, or reading books that you enjoy? So take a few minutes and think. Either you can write if you have a few minutes to write right now, or you just want to think about this. Okay. Now, the next exercise we're going to do is called heart math. And heart math is a stress management, evidence-based breathing exercise. So we want to focus on the area around our heart. Imagine breathing in and out of our heart, and focus on appreciation, gratitude, and joy. So I'm going to go back to the next slide. And a lot of healthcare professionals love heart math as a breathing exercise because it's evidence-based. And there's apps you can buy and connect to your finger and your ear when you're doing it and connect it to the computer. And you can see your heart rate variability between heartbeats. And if it's smooth, that means you're in a place of coherence. If it's like this, you're not. So I want you just to think, either think right now or write down 3 things that brought you joy this week, an energy gain. And then think of 3 things this week that depleted your energy, an energy drain. Okay, so now we're going to do this exercise. I'm going to guide you through it. And the whole purpose of the exercise is to clear your head and get into your heart. So when we're in our head, we're either dwelling on the past or anticipating the future, and we don't have the answers. When we're in our heart, we have the answers. So we're going to focus on breathing in and out of our heart, even though we breathe in and out of our lungs. But for the purpose of this exercise, just focus breathing in and out of your heart. So put your hand on your heart, and you can close your eyes for today, but you don't, when you do this in life, you don't have to close your eyes. So just put your hand on your heart, focus on the area around your heart, and imagine breathing in and out of your heart. So just breathe in and breathe out. And breathe in and breathe out. Breathe in and breathe out. And as you're doing this, you're starting to feel more relaxed. If you're sitting in a chair, you're letting the chair hold you up. You're really allowing yourself to relax. You're breathing in through your heart and out through your heart. Imagine breathing in through your heart and out through your heart. And if there's any stress in your body, wherever you hold tension, send a heartfelt energy, release and unlock the tension and blow it out as if you could see it leaving your body. So breathe in heartfelt energy, breathe out stress and anxiety. Breathe in through your heart, out through your heart. Imagine breathing in through your heart and out through your heart. Breathe in what you appreciate and gratitude and joy this week. When I had you think of 3 things this week that brought you an energy gain, breathe those into your heart as if you can savor them in your body. Breathe in through your heart and out through your heart, and breathe in the 3 things that brought you joy and were an energy gain. And think in your mind, can you do this and breathe these in and do this exercise to help you when you have to do things that deplete you, that are energy drains? So this gives you more energy to get through those things. So breathe in through your heart and out through your heart. And just hold on to these things that brought you joy this week and gratitude, as if you can feel them go to every cell of your body. Okay. Okay, so I hope that helped a little bit for you to relax today. And I want to talk a little bit about our program. The name of our program is the Center for Work and Family Life. And if you'd like to learn more about these tips and tools in more depth, today was kind of a very short version, just 15 minutes, you can call us. We are currently providing mental health support for employees, all USC staff and faculty via Zoom and by phone. Our hours are Monday through Friday, 9 to 5, and our phone number's on this slide right here. And we also have an after hours phone line, so if you need that. Does anybody have any questions about the tools and tips we went over today?
They can unmute themselves, I think.
Oh, if you have any questions, you can unmute yourself, or is there a way to, or put it in the chat box, or is there any questions in the chat box?
Not at the moment.
Okay.
Thank you so much. This was very helpful. That's from Connie. Thank you, Connie.
Okay, well, if anybody has any questions, I'll be around for a few minutes. If not, thank you very much, and I hope you can take these tools to help you this week.